Hey guys, if you're watching this video, then you are having issues in the bedroom. Perhaps it's with performance or pain or a combination of both. And the likelihood that you've probably seen a healthcare practitioner, you've maybe gone to a urologist. Many of the men that I talk to have gone to 3, 4, maybe 5 urologists. They've had tests after test, nothing is found, or maybe something may have been found and you've been on antibiotics and they haven't really changed anything. Maybe they temporarily helped, but now it's like you're on your 3rd, 4th antibiotic and it really isn't doing anything. So if you are having performance issues and you are having pain down there, then this is the video for you. I'm Hina Sheth. I'm a pelvic floor and orthopedic physical therapist from Rebalance Physical Therapy in Philadelphia, Pennsylvania. And I actually did a TEDx talk on this exact same topic, which the link should be somewhere here or down in the information box so that you have reference to it. But first, let's talk about some of the symptoms that a lot of men have down there and then why that might be happening. So, first of all, as far as age, it does not matter. I have had young 17-year-olds all the way up to 70-year-olds that have these exact same symptoms. So it doesn't matter what your age is, and that doesn't matter. So the big thing is the symptoms of these can be anything from rectal pain, bladder pain, abdominal pain, scrotal pain, testicular pain, epididymitis type pain, prostate type pain, and then even perineal tightness restrictions are just some of the pains that you might be experiencing. And then the other things that you might be experiencing as far as function is that you're having pain or inability to have an ejaculation, or if you do, you're having pain, or even with an erection. And then possibly even post-ejaculation. Some of you might have pain that lasts a couple of hours, but some of you may have pain that lasts for days. And I know all of this is crazy scary, and this is why you probably try to look for help with the urologist. But the other piece of all of this is that other functional things that people don't put two things together is that all of this could also be causing things like bladder retention and bladder frequency, feeling like you have to go to the bathroom all the time. Feeling like when you do go to the bathroom, you have to sit there and wait and kind of relax your mind in order for you to have, just pee like like you normally did when perhaps you were younger at some point. Perhaps you go into a public bathroom and it's really, really hard for you to understand why is the guy next door can literally pee like a fire hose, except you have to sit there again and wait. So I've heard this all before. Now, the other things this can cause, it can also cause constipation. And so if you're seeing that these might be also kind of intertwined with how you're feeling, then again, you're on the right video, and we're going to talk about why. Now, the other pieces that you may also potentially be putting together is some of my men also end up having other weird orthopedic pains that they're not putting together. So perhaps there is, some groin pain. Perhaps there is some lower leg pain. Perhaps there is some hip issues that are going on. All of these might be all combined into one. So what is going on and what could be causing this? So one of the biggest culprits is a particular group of muscles called your pelvic floor. And now I'm going to show you this model. And I have been told on some of my other comments in my videos that, she can't afford to get a male model. Who cares? Okay. What matters most is that the anatomy is pretty much the same when it comes to the musculature. So this is a female pelvis, but if we look inside here, you can see all of this musculature inside the pelvis. This is called your pelvic floor. These muscles are a group of 14 muscles that actually help your bladder, your bowels, and your sexual function. So if there is a problem with these muscles, okay, and you can see them from this side. Now again, this is a female, but if you imagine that there is a penis here, then that pretty much entails what the outside of the male genitalia looks like as well. Or not the genitalia, the musculature. So when there is dysfunction in these muscles and they are not working properly, it could be lots of things: coordination issues, tightness issues, restriction issues, okay, which also then causes weakness issues. then this can end up causing all sorts of dysfunction. And again, urologists may not fully understand what is going on down here because it's related to muscle, yet you're having more visceral or organ type issues that you may have not put these two together. So when there is a problem in these muscles, it has to be treated, okay? And so these muscles don't work alone. They also work with other parts of the body. Remember, your body is not, it doesn't perform in pieces. It performs together as a symphony of a whole group of muscles. So there's lots of other muscles that influence what's going on here. So if you are having these symptoms, then I would say if you've gone to your urologist and nothing's really coming up, then there's a pretty solid chance that this is where the problem is. Now, what do you do about it? So in my next video, I am going to go into a pretty in-depth discussion of what exactly causes the problems behind this muscle, as well as what are the other groups of muscles that tend to be problematic. And then also what entails with treatment. Sometimes it's a combination of medications. Sometimes it's, a very particular sequencing of treatment, and what other modalities can actually help. And so, all of this can, for many men, be treated. You just have to know the right sequencing, the timing, and you have to kind of have the right intervention to make that happen smoothly. So I hope this video was helpful for many of you guys. We put up lots of videos, different videos, both with orthopedics as well as pelvic floor issues. So subscribe to our channel. We also have a clinic located in Philadelphia, Pennsylvania. All of our information is down below, as well as more information that you might find helpful. So all that information is down below, and stay tuned for the next video where we go into a pretty in-depth discussion about this topic.